Yeah, we are live.
Greetings, everyone. I hope you all are doing good during this pandemic. My name is Nandita Thakkar, and I am a pre-final year MBBS student from Mumbai and also a part of the organizing committee at MedInvade 2021. I'll be moderating for today's session. I'm very happy to welcome you all to the fourth day of MedInvade 2021. For today's session is on vaccination and understanding vaccine hesitancy by our honorable speaker, Dr. Noor Baran AKSAKAL. She is MD, PHS, and a Master's in Science. Dr. BARAN AKSAKAL is Professor of Public Health in Gazi University, Faculty of Medicine, Ankara, Turkey. She has graduated as an MD from Hactib University Faculty Medicine, English branch in 1997 and completed her residency in Gazi University Department of Public Health, receiving a degree of Public Health Specialist in 2001. She also has a MSc degree in environmental medicine from Hactib University Institute of Medical Sciences, Ankara, Turkey in 2009. Since early 2004, she has been continuing her academic investigations and studies in Gazi University Department of Public Health. She has worked for WHO, World Health Organization, Euro, on immunization-related areas, mainly on training of healthcare professionals, mid-level manager, trainings on immunization, and consultancy in establishing adverse events following immunization surveillance systems in Eastern European countries. She has also worked in WHO Euro office in Copenhagen, Denmark, as a short-term professional in 2003. She has participated in several trainings for mid-level immunization managers of European countries conducted in collaboration with International Children's Center, ICC, as a trainer and a moderator. She acts as a member of WHO Euro, European Technical Advisory Group of experts on immunization since 2016. Currently, she has focused her life on life course immunization, vaccine hesitancy, vaccine communication. We are extremely privileged to have you with us, ma'am. Before handing it over to ma'am, I would request all the delegates to put the queries and questions in the YouTube live chat so that we can get them addressed at the end. A post-event link will be posted at the end of the session. Kindly make sure you fill that to receive a certificate. Now I request ma'am to address our delegates.
Thank you very much. I want to say hi to each and everyone that are currently listening to us and will be listening in the future. And I really want to thank you all to invite me here. And it's really a very big pleasure for me to be with you as my forthcoming colleagues throughout the world. Now, yes, this is a topic that we have been into for a long time, and during the COVID period, during the pandemic period, the discussions about the vaccines, new vaccines, and the vaccine hesitancy has been strengthened throughout the world. And it became an infodemic, which is much more important than managing the pandemic these days. And vaccine hesitancy is something that we have started to work on further and more than we were doing before, because it is really an increasing risk in front of the vaccination programs throughout all countries and throughout the world. That's why I just prepared you a presentation, and I'm now sharing it with you. And just think this about a chat and a discussion with an expert on the vaccine hesitancy and trying to understand the human being, in fact, or in other words, being human. Because when you are a human being and you have your background characteristics, background thoughts, background beliefs, that you are affected when you're deciding about a new issue that's coming to your life, which may be a vaccine in the pandemic session. Now, yes, we will be talking about vaccination and understanding the vaccine hesitancy, but before that, I want to declare the conflicts. I have no financial conflicts, and I am a member of European Technical Advisory Group of Experts in Europe, and member of working groups on hepatitis B, and a member of National Immunization Technical Advisory Group of Turkey. And I strongly believe that the vaccines are safe and effective, and serious diseases can occur if not immunized. That's why I have spent more than half of my life on vaccination issues and now focusing on vaccine communication. And during this session, we will first talk about the factors influencing the vaccine acceptance and the vaccine hesitancy, what is it, and what are the barriers. And we will talk about a little bit on infodemics and infodemic management, which is a new era, and it's a very quickly growing era, and I think you should have an idea of what's going on infodemics throughout the world. And we will lastly discuss how we can address the vaccine hesitancy. Now we know that the vaccines work because when you look at your fathers or mothers or your relatives or the people older than you, you may see the scar on their arm, mostly on the right arm usually, and you will see it. And that is most probably a smallpox scar. And here you can see that it's a smallpox vaccine scar. And why don't we have it no more? Because it worked and it has eradicated the smallpox. And this is a very prominent feature of the vaccines. If they work, you get rid of the deaths and disabilities due to the vaccine preventable infections. And vaccines work, and it's one of the, if not the first, of the public health achievements in the last century. And only safe, clean water can perform better. And vaccines save lives, and thanks to the vaccines, we don't see any burdens or disease burden on the vaccination infections, vaccine preventable infections, because they are not seen in many areas of the world where the vaccination coverage is high. But still we have problems in many areas around the world because the coverage is low. And vaccine hesitancy or vaccine refusal, and we in fact, for the last few years, we don't want to use the vaccine refusal because vaccine refusers or deniers are a group that is really not easy to combat with. But the vaccine hesitancy is something that many people may have on mind. Even we can have it in our mind, and we can change the minds of these people. That's why we are focusing on the vaccine hesitancy and the barriers around among the in front of the vaccine coverage. And when we talk about the protection by vaccination, we are not only talking about the individual protection. Yes, there is an individual protection. You may be protected when you're vaccinated. You will be protected 95%, more than 95% chance. But if you have an immune system problem, or if you don't have an access to the vaccination, or if you have if you don't have any enough tools to access the vaccination, then you will not have the protection. But it is individual. But when we're talking about the importance of vaccination coverage, we are talking about the community protection. And thanks to the thousands and millions of people who are getting vaccinated, the whole populations and the whole communities are protected. And this is called herd immunization, herd protection, which means that if you have a certain group of the individuals in a population vaccinated, then the ones who have immune system problems, immunosuppression, or the ones who cannot have an access to the vaccination, and even the vaccine deniers are protected because the circulation of the vaccine preventable infectious agent is put under control. And there is another strategy that we're using, which is called cocooning. This cocooning means you just prepare a cocoon which protects the child or the newborn. But you cannot vaccinate the newborn, but when you vaccinate the people around them, the caregivers, the grandparents or the parents, then you can have the new baby in the cocoon and protect him or her by this way. So when we're talking about vaccination, just keep in mind that it's not only individual, it has a community perspective. That's why we're trying to combat with the vaccine hesitancy. So what is vaccine hesitancy? It is a delay. It's WHO's description, of course. There are other definitions that you may find in the literature, but this is the simplest one, I think. It's delay in acceptance or refusal of vaccines despite availability of vaccination services. There is vaccine, there is vaccination service, but the people are not getting vaccinated because of the hesitancy or just because of their learned behavior. So when say you don't have COVID vaccines in the Africa region, for example, and there because there is not enough vaccine available for those countries, this does not mean that they have the hesitancy. Hesitancy occurs when there is a vaccine, when there is an available vaccination service, but the people or the person do not uptake the vaccination service. This is what we're meaning by the vaccine hesitancy. And this is a real, truly global challenge, unfortunately. And more than 90% of countries reported this issue in their countries. But when you include unreported ones, I believe that this is 100%. All countries are facing vaccine hesitancy. And it threats the historical achievements made by the vaccination. And this is also counted, vaccine hesitancy is counted one of the 10 global major health problems that we will be encountering in the coming decades. And vaccine refusal, of course, it's not a new issue, and it has started with the vaccine production effect. And Edward Jenner's work, these cartoons has been prepared after Edward Jenner's work on smallpox vaccine. And smallpox has been eradicated with the efforts of a huge number of healthcare professionals all around the world. But when you look at the ones on the left-hand side, you can easily see that some people have faces which look like the animals, cows, because the cows were used to prepare the vaccine, smallpox vaccine. And people have rumors about turning out to be a cow at the end. And not only that, they also had claimed that the women or the young girls that they have been vaccinated by the smallpox vaccine may be falling in love with the cows. And you may just laugh here when you hear about this, but there are clues that people were believing in this, and even they were picturizing it. And on the right-hand side, you can easily see that there is a monster sitting in the back of the carriage, and there are vaccinators on top of the animals, and there are kids running away from the vaccinators and do not want to be vaccinated because they think that it's a witch, an evil thing to have been vaccinated. So it's not a new issue. But there are modern ones, of course, the Douglases, Wakefield, or Douglas and Wakefield. You may have heard about autism and the measles vaccination relation to plagues. And until now, there are millions of children that have been involved in clinical trials. And it has been shown that the autism has been increasing, even if we don't have any mercury anymore in the vaccines. And it clearly shows that there is no link between the autism and the measles vaccination. But when you look around and when you search and ask people why they are hesitating, they may say that it's causing autism. Even the science has provided many clues and many evidence that says the opposite. People still are continuing to believe it. Why? Because we have Mark Geyers and his son, David Geyer. Are these science people? Yes, they are medical doctors. But when you look deeply, Wakefield has a problem and an ethical issue, and he has been also concerned about the lies that he has in his publications. And on the right-hand side, you can easily see the father and son who are MDs, but they are selling a cure, a drug, which is not licensed, and they claim that it was, though they say that it was curing the autism cases. So there was other benefits that they were waiting from the anti-vaccine vocal denying issue. So this is the modern ones. Of course, there are others like Jim Carrey carrying photos of the McCarthy's, who is an export artist, and the ones that in America we have many anti-vaccine movements, and even in Turkey I have provided you 2 books and a lawman, and he's a lawyer, and he claims that the measles vaccine has caused autism in his son. So there are people that they are instantly saying that the vaccines are not safe, and still they are using an evidence that is not an evidence. And so you have to think that human beings are diverse, and the vaccine hesitancy is also diverse, because no one is the same with another person. And our perceptions, our understanding, our educational background, our cultural background, our social background, our political background are very different from each other. So there are people that are affected by these claims that is vocally said by the individuals, even who are famous individuals, in fact. And so when you're talking about the hesitancy, you have to first understand that no one is same with the other one. And when you're dealing with the vaccine hesitancy, you have to first understand why are they vaccine hesitant? What is the question in their mind? What is information they are in need of? And what factors or the barriers are causing vaccine hesitancy in that specific person? So listening is very important. First thing that I will be telling you in the coming future. But just remember, the families or the person is also in favor of their children's or their health, and you are also. So both sides want the health as an outcome. But when you're talking about the vaccine hesitancy, if you don't start with, I understand you, you have questions in your mind. You have different evidence from all over the world about the vaccine safety issue. Yes, I understand that. But I am wondering yours. Why are you hesitating? Let's discuss this. Let's talk, because I also want your child to be healthy. And I understand that you also want your child to be healthy. And you are selecting between the risk today and the risk in the future. Let's talk about this. What is your reason? So this is the very important starting communication point, understanding and then learning the issue and then giving the information. We will be talking about the post-truth about this. And of course, there are reasons and diverse reasons of vaccination hesitancy. The lack of awareness, knowledge. Yes, there is a lack, but even people have information, they may also hesitate. And risk-benefit concerns remain the most often cited one, but even this is not more than 30%. And there are particular concerns that politicization of immunization, they're trying to kill us, they're trying to rule us, they're trying to monitor us, whatever. And social media accounts have been used to provoke the debate about immunization safety. And the same groups are usually questioning the national authorities, trust again national authorities. Some are in favor and some are some are opposing. So politics is within the immunization, and there are attitudes from outright rejection to passive acceptance, and there are multiple influences through widely differing agendas between the populations. So it's a vague issue. It is not very solid. You don't have answers to each and every situation, but it's rather complex. That's why understanding and coping with is also complex. And we will talk about this. Now, there is a herd mentality. Yeah, I talked about the herd immunity with you. Herd immunity is a group thing, as I have explained. When you have a group thinking about the same way or vaccinated and you are protected, this is some herd mentality, is something like that. People are, let's say, they hear that the virus is a hoax, or they hear that it only infects the blue states, and if they hear that the face masks are just a placebo, something like that. So people hear and people believe in this. And at the end, they may even die. And they even take the risk and they may be hospitalized. And the end will be different in different settings. But this is herd mentality. And when you rely on what you have heard only, then you are absolutely misleading. And there is an infodemic here. And infodemic management is a new era that many people are working on it. And WHO has a team on information, infodemic management team, and EpiBrain team is working on this. And what is infodemic? It is the excess of or a lot of information coming from different sources. Some are scientific, some are only hearings, some are rumors, the others are from the experiences, and most of them, almost all, is produced by the people using these media, the social media or other media that the internet, for example. And when you are trying to understand the infodemic, just remember that on March 2020, the WHO's head of the WHO, Tedros Adhanom Ghebreyesus, what did he say? He said that infodemic, we're not only coping with or fighting with the pandemic, we're also fighting with the infodemic, which was really very true because people were hearing something, people were reading something, people were believing in something. And these are reflected to the behaviors of these individuals. And they may not get vaccinated, or they may not even go to the healthcare centers, even if they have the symptoms of the disease, because they believe that it is not a heart disease that they put them under risk. So this is an epidemic manager unicorn, and there are training management. It should be adapted, and you have to monitor it and evaluate, and you have to understand the public health and outbreak response. And very important one is you have to have a communication plan, which is social science and behavioral science are involved in. Because when you have different information sources, different kind of information flowing from everywhere, people cannot choose what to trust and who to trust. So you have to first see what's going on, which hashtags are increasing throughout the world, which is called social listening. And I will come back to this, and which we call it social listening. And challenges and opportunities to advance the social listening are there, and we're trying to use it more and more because just like the pandemic curve, we have an infodemic curve. During the infodemics, many information sources are producing information, and it is spread away enormously fast. And what happens at the end? You write something in Turkey here, and the one in the India or in Europe, one of the European countries, reads it in seconds. And when he or she retweets it, then it's spread throughout the world. And now we have tools and teams that they can follow this spreading of the bad and good information. Because infodemic is not only the bad information, there's also good information, but it's less than the bad ones. But I will show you other graphs that makes it easier to understand. When you talk about infodemics, you have to also talk about infodemiology, which is a science of understanding the infodemics. And you have media studies journalists, epidemiologists, and public health specialists. You have risk communication and community engagement people. You have ethics and law governance and user experiences and marketing. Social behavioral sciences are very much involved in epidemiology. What we do is we just evaluate and understand how the wrong information is being spread. And what we do is we just get prepared and we also spread good information before it is spread elsewhere or in answer to the spread infodemic wrong information. So this is something that you will be as new generations working on, and I'm very happy if I can track your attention here, because it's really very important area, and I believe and want most of you to be involved in these infodemic studies, management studies. So everybody wants change. When I ask you about, do you want change? If you will say that, yes, we want change. We want to change this. We want to decrease the vaccine hesitancy. We want to increase the coverage. And we don't want people to believe in wrong information. But when I say who will change it, everybody looks around. But this is not so. You have to use your power as healthcare professionals and future professionals. Even now, you are the ones who have the power, because information is power. And you have the information. What is lacking is the ability, the skills to communicate what you know. Because communication means the message you have in your head, and you have to convey this message to the one who's listening to you. But there is a huge noise in between. So how will you manage with that noise? And how will you make it possible to make that people think as you think? And your message will be the same in his brain or her brain. So this is communication. And you have to increase your communication skills if you want to be successful. So, of course, you may think that infodemics is impossible to eliminate. Yes, I believe, because there is internet, there is social media, there are people sitting in their chairs and writing the whatever they want about the vaccines, vaccinations, even science people. But yes, you cannot eliminate, but you can manage. And this management includes some steps, because pandemics are characterized by fear and uncertainty. And uncertainty feeds the infodemics. When people are uncertain about things, they just have conspiracy theories, and they are very keen on sharing this with the others and fortifying it with the people's ideas that which ideas are parallel to their ideas. And you see that there's a huge group is thinking like them, but in fact they may not. So this is dealing with the infodemic have 4 steps. The first one is listen to concerns and try to understand. You just put aside your biases and understand why the behind questions understand, and you have to understand the fear and why people are having fear about this. And second is translate science and communicate risk. I will be showing a very good graphics for this. And just the information is based by science and rely on evidence-based interventions. You have case studies, whatever it is, but you have to follow the best practices to communicate this information with the ones who are in need of it. And you have to promote the resilience to misinformation. This is very important, because not misinformation and disinformation is something that may be coming out from real evidence. For example, when people claimed that in 1998 the MMR vaccine was causing autism, what happened is just they have the firms that are producing the vaccines took out of the ethyl mercury from the vaccines. Why? Because there were claims which were not proved to be true, and they just pulled it out. But still, the autism cases has been increasing because of many other reasons, environmental reasons, genetical reasons, whatever. But what they said is, the other one, the vaccine deniers said, look, we were right. They just took it out, but it's not the way it is. So just since we couldn't be able to explain why the mercury was removed from the vaccine, then this turned out to be a misinformation. So we should be very, very, very cautious on this. And we have to engage and empower communities. If they don't believe in you, they will not change their behavior. And WHO, of course, collaborates with the vaccination. And by the way, I just gave the resources here as a footnote, but I would like to thank the team because it's really, they are working very hard to prepare the infographics that I have been using. And we have talked about the social listening, which has been, of course, you should be very ethical when you're doing this. But this is something that is not individualistic. We just follow, the main idea is to follow up the hashtags and the words that is vaccines hesitancy, or any misinformation that is spreading out in the social media, which means that you have to follow them up in order to get ready and in order to prepare some answers to all this, of course, within the ethical principles. And this is an emergency in the pandemic, and you also have a communicating science during the emergencies. Just we have emergency preparedness plans, which means that who will do what in case of an emergency. So these plans should have, and also in fact they have, a communication plan integrated to the general plan. But usually it's a small part and people are not engaged in communication. But when it comes to getting vaccinated, or when it comes to using masks, when it comes to understand the risk for the pandemic, communication is very important. And people do not change their behavior if they don't really have a good, if the healthcare givers do not have good communication skills and know what to say. And social media, of course, as I have mentioned, is very much embedded or in fact, science is embedded in social media. And there is social media science, yes, but there is science on social media. So social media really has a very important effect of the post-truth of vaccine hesitancy. Now here you see that the social media, the one who is being informed through social media, reads about an adverse event following immunization. Of course, the vaccines are not 100% safe. There is a risk of getting hurt from the vaccines because they are drugs, but you have a risk of getting hurt when you step out from your house. And having an adverse event, a serious adverse event, is less risky than any daily activity that you're performing, going to school, having classes, eating. It's not risky than eating something or drinking a drug. Taking a pill is much more risky, thousands of risky than getting vaccinated. But when you have an adverse event, somebody is sharing here, even there's a herd mentality, and he looks through a very small hole and sees some water particles. And he says that it's raining. You're lying me. I can see it all from here. There is rain. But the truth, the science says, no, it's a rainy day. It's only a small portion of what there's a water depot there, and it's normal that there may be a leakage. But people should understand that this is a sunny day, but you have water depot and depot may be leaking. So how will you communicate this? with the individuals. So this is what the healthcare communication experts are now working on. And the most common mistake, one is the deficit model. We believe that if we give them enough evidence, because we are healthcare professionals, we are overlooking them. This is another mistake. And we have more information on health, and we are experts, so we know everything. And we say that the vaccine is safe. You have to believe this. Yes, there are lots of things the science says that and gives evidence, but they may also even listen to you. They may also believe in you, but they may behave differently. We think that don't smoke, why people are smoking. So do exercise. It's shown that it's lengthening your life, but they're not exercising. So you have to accept that when you give the piece of information or the science, it's not necessarily causing a behavioral change. So there are other areas that need to be worked on. It's a potential vaccine. And there are people who are thinking differently, and because they don't have enough information, or because the people they believe in have different information or different beliefs, because they are escaping from the truth. It's another post-truth thing. And here, because you say that you know that I'm a wolf, why don't you run away? There is a pandemic, it's killing people. There's a virus, and it's SARS-CoV-2 virus. And we know that it has a 1% fatality. Oh, so why are you not afraid of me? And some sheep say that we rely on herd immunity. Some people are having the disease and the others are getting vaccinated. So why do I have to bother myself and not take the risk? And the other says there are no wolves. There are people who believe that there's a pandemic. It's kind of flu, and you are exaggerating it. There are people there, don't you? Do you have people around like this? And a healthy, well-trained body survives a wolf bite. So why do I have to escape? And the other says only old and sick are attacked by a wolf. And the scientific people say this. So I'm young, so why do I have to run away? So this is what happens during pandemics. And of course, I don't want to say that we're shit. the agent is the wolf. But this is a really very good graphic. And I really liked it so much. And thanks to the efforts to prepare this. This is what we are living every day. And there is a cognitive dissonance truth, and it's a mental discomfort that results from holding two conflicting beliefs, values, or attitudes. What do I mean by that? If you believe that the modern world or the science people are trying to kill us or put some chips into us, then when they bring you a new vaccine, you will say, this is the chip. So this is the cognitive dissonance. Or the Chinese, or you just remember that the countries are producing vaccines, and they are firstly named by the countries that they are invented. For example, it's German vaccine or Chinese vaccine or whatever, American vaccine, whatever. So if you believe that that country does no good, then you will not believe in the vaccine that they have been producing. So this is when you have two conflicting ideas, then what you do is you select the one who is very close to your previous political and cultural beliefs. And that's why people are just like fans supporting a sports team. Just say that, oh, they don't do well. Every product that they are producing is not qualified and not in good quality. Then the vaccine that they have produced will not have the quality that's needed. So this is another cognitive dissonance truth that we have to keep in mind. And there are variants around the world. Of course, we are talking about the variants, new and hazardous variants, more hazardous variants of the virus that we've dealing with the Delta variants, Delta plus variants, etc. But there are also people who are variants. They say that it's like flu, the COVID vaccine is a government law, masks don't work, COVID vaccine doesn't work, it's just the flu. So there are variants of beliefs and thoughts, and they are getting more dangerous within time. And what we're doing is we are, as a misinformation study group, we try to find out the more dangerous variants and trying to prepare some answers to these variants. And getting a scientific message across means taking human nature into account. As I have said before, it is about human being and it's about being human. So we have to first understand that how communication works. First, you have to make a collaboration of the one who has a hesitancy, and then you have to discuss. When you're talking upon the population or upon the individuals, they will not listen to you. It's not a world like that. And there are anti-vaccine tactics they are using. So you have to learn these tactics. It doesn't change so much. They are poor tactics. The skewing science. They are denying or rejecting science that fail to support anti-vaccine movements. And they are shifting the hypothesis. They have new theories. The vaccine has the blah blah inside, so they will absolutely harm us. And they are censoring the dissenting opinion. They are shutting down the critics. They are not listening to the critics. And they are attacking the opposition. They are critiquing people, personal insults, firing legal claims. You don't have right. This is a human right that I will not get vaccinated. This is my choice. So they have some anti-vaccine tactics. And please learn this, how they are using this, because the time given me today is not enough for this, but there are methods to cope with these tactics. And there are people, they're eligible and they are accepting all vaccines. And there are people who are hesitant, and there are a smaller group of individuals who are rejecting or refusing the vaccination. So what we have to do for the ones who are still accepting all vaccines that you are proposing? You have to keep the trust, because they need to keep their trust, because the hesitants are coming out of these individuals. They have had their vaccines, their childhood vaccinations. They have vaccinated their first children, but when the time comes to the second one, they are affected and they become vaccine hesitant. And this hesitancy may be for one vaccine, for example, they may not be rejecting or refusing or hesitant about the rest of the vaccinations, childhood vaccinations, tetanus, etc. But they may be hesitant to the new one for the pandemic, for example. So it's not a homogeneous structure that you're talking about. So when a person comes to you for vaccination, please appreciate what he or she does, because he did something that is good for him, but also that's very good for the community, for thank them. And then the ones who are hesitant, this hesitant group is the most important group that we are dealing with. And they have a capacity to be vaccine acceptors. So we are working on this, and we are trying to build trust on this group. And we use stories, and this is the group that we are really thinking much about how we can cope with vaccine hesitancy, because these rejectors or refusers, then you can also follow them and use their stories. They have just refused the vaccination and they got ill. Of course, we don't want them to get ill, because when they get ill, they pose risk to other ones, at least. Not only they take the risk, but they also put the others at risk. So this is also very important for us. But you have to follow them up and see the results if you are not getting vaccinated, and use them, please. So This is the group that we are working on, as I have mentioned. So this is a complex and context specific, and it varies across time, place, and vaccines, as I have mentioned. And it is influenced by many factors, and it's a problem with high income, middle income, and low income countries. So how can we change the decision? Is it changeable? Now, there are studies that carried out on these people, and it has shown that if a vaccine denier, if it's a vocal vaccine denier, if he's vocalizing his anti-vaccine attitudes within the community and the population, there is very low to zero chance to change their mind, because most of them, not if not all, has a hidden agenda. They have books, they have products to sell, they have in need of being famous, and you can see that they have other conflicts of interest, and it's really very hard to change their mind. And when you see them, even what we recommend is, even in the TV programs, just keep your message. Don't try to give them answers, because this is what they want. They just want to pull you into chaos. And in chaos, you will lose yourself also. And they will claim you, and they will accuse you in incredible areas. So this is the vaccine refuser group. Yes, they refuse the vaccination because they are affected with different kinds of resources, but still there is a little chance to change their mind. What we are talking about is the hesitant individual, and they have a high probability of changing mind towards vaccination. So what are the factors influencing vaccine hesitancy? It's the complacency. They say that the perceived risk is low, so I don't need any healthcare, or I don't need any vaccination. And the other one is convenience. They may not have physical access availability. They cannot afford it. Or there are problems with the geographic access, etc., or language barriers, or health literacy barriers. So these convenience is the other group. But confidence is the important one, which you can only change with communication. Because trust in vaccines, trust in vaccine delivery system, trust in the policymakers who decide which vaccines are needed and when they are needed affects the confidence of the individuals. And this is where trust is very important. This is where the anti-vaccine movement is attacking mostly. Because two others can be very easily ruled out. But the trust is something about the belief and knowledge. So it all happens when the parents or the individuals meet you to get vaccines or have a chance to get vaccinated. And the vaccine communication is because there are lots of anti-vaccine ideas, information that have reached to them. But after they see you or communicate with you, they either accept or reject vaccination. So you have to be aware of the strength of your decisions about the patients and your strength, or your how can I express it? Your anyway, let me say in other words, your attitude towards the one who has vaccine hesitancy is very important at the patient level. And there are lots of literature, lots of papers published on your force or on your strength to affect the individual. Each study says that when my healthcare person that I really have a confidence in recommends me strongly, then I'm affected. So just please keep in mind that you really have a good force to recommend these vaccinations, and people believe in you. And how can you say that? You may think that, don't they know the vaccines work? What is knowing? Knowing is something that is really unmeasurable. And why people do not understand the vaccines are safe and needed as we do? Because we read the same literature, but I understand that the vaccines are preventing the infections. I understand that the vaccines work. Why don't they? Because knowing has some layers. Now, they sometimes take the data here, and when you put the data together, you get the information pieces. And these information pieces are the ones that you are providing with the 140 characters, I think, as far as I remember, in a tweet, when you tweet, only you have a limited number of cases that you can use. And you just have to give a short message, which can include only small piece of information, and people can take and use it. But when it comes to knowledge, this is what you have about the vaccines. You have a link, and you have prior experiences. You have seen patients. You have seen what happens if they're not vaccinated. So you have a more chance to link what happens if they're not vaccinated. And this is knowledge. And not all people have the knowledge about the vaccination. And insight means that you just feel it, and you have attitudes and behaviors. You get vaccinated. You are supporting vaccine in every issue because you have insight now. You have seen everything. You have understood the people and how they work. And if you have wisdom, you get prepared to what will be happening in the future. You prepare the communication plans, because in the coming future, people with wisdom will be needed, because the people need to be vaccinated. But the conspiracy theories are always magical, and it draws attention of the individuals. And people, without having information, has conspiracy theories, and they are sharing it. And knowing, understanding, having an insight, acceptance, all these issues have something to do with the communication. And you have to remember that there are important areas where science has reached a consensus, but the populations or even leaders do not agree. What happened, you just remember at the first messages that was spread by the world leaders about the pandemics. So fact and belief always have a combat between for the years, for centuries. You give the fact, but you have to change the belief, which is not very easy. Because when the fact is consistent with the belief, it is accepted. And these holes reflect what is your cultural, scientific, educational, political background is. And if the fact is consistent with your beliefs, yes, it is accepted. And you now believe it, so you just behave accordingly. But when the fact conflicts with belief, it is rejected. And this is what happens when you say that the vaccines are safe, the vaccines are safe. If they don't believe it, they will not accept it. What you have to do is you have to reshape the fact, and you have to, at the end, change the belief, which is vaccine communication. And this is what you have to be more skilled in the coming future. And in the strategies to address vaccine hesitancy, it says, yes, it's a global problem, and there's no specific strategy to overcome the hesitancy in all populations, because it depends in different populations. And there are strategies that improves the vaccine uptake, but this is something that you have to use multi-components in order to fight with the barriers, because there are cultural, social barriers, and communication is the only way that you can come up with, you can cope with. So more communication, more vaccine communication. If we have time, sometime, I would like to also very willing to discuss what vaccine communication with you, but today we will just try to understand the vaccine hesitancy. And the approach, you have to put the diagnosis first, try to understand who is hesitant, and tailor strategy to fit means every individual is unique. So you have to understand why they are hesitant, and then you have a tailored strategy to fit in. And you have to assess the outcome if they are getting vaccinated or not, and you have to support the resiliency of those who are pro-vaccine. You have to fortify them, you have to work with them and work for next generation, which I'm trying to do today, because you're the next generation and we're relying on you to having the vaccine success in the coming future. That's why it is very important today. So safety issues is very much related to the trust, and you know that there are phase studies, and each of you should understand why we conduct these phase studies and why these phase studies can be shortened and what is the limit to get a shorter time for the phase studies. So we first have to keep our trust and feed our trust, because there are people who are requesting the vaccination, but there are people who are refusing the vaccination. There are people who are passively accepting the vaccination. Yes, we will appreciate the ones here, but we have to also increase the trust through vaccination, and policymakers. I will not go deep into these, but we have to be proactive, not just reactive. So you have to keep this in mind and try to pull some or get some personal hesitancy communication plan, so that in the coming future you are proactive and you should answer the questions that they have in mind. And it's a two-way process. Please just do not talk, just listen, please. First, listen. And the knowledge is not enough. It's important, but it's not enough. So you have to exploit cognitive shortcuts. There are shortcuts that you can use, and you have to have tools. You have to use your mass electronic media, digital media, social media, and mobile technology to disseminate the information and the communication that you're using in order to decrease the hesitancy. And you have to tell the compelling stories. And so keep the compelling stories. Keep the things that the news or the, for example, diseased individuals that you have experienced in mind, and take notes and records. In time, you will have to use them. And so you have to first strengthen your trust and get ready to face and communicate hesitant parents and individuals, and just answer these questions for yourself. What is thimerosal? Is mercury derivative? Is it harmful? What's the vaccine? What is in the vaccines that I'm administering? If somebody says, what is it? Can I answer it? So this is the ethical one, now to persuade the ones to get vaccinated. Just, this is the end. I know that I tried to wrap up in a time that was given to me, and I believe that we have some time if we have. But just, I want to remind you that nothing and nobody is more precious than you. It's not a narcissism. It's just knowing and loving yourself. So just give yourself a hug as if I'm hugging you, and just keep this in mind in the near future. I hope all of you will, I just wish you luck, and thank you for listening. Yeah, let me take the questions for now. Nandita.
Thank you so much, ma'am, for enlightening our audience. Ma'am, can we take up a few questions which our audience may have to ask?
Please.
Ma'am, we have, like in India, we have some alternative medicine systems like Ayurveda, homeopathy. Is there any traditional medical systems or alternative medicine systems in Europe or in your country? Like, Yes, ma'am. Please elaborate.
Yeah, we also have those kind of alternative medicine, let's say, promotion these days, because they were doing, but the chances, they first say that this is something not important, it's just like flu, so you just can get rid of this very easily, so their voice has been tapered down within time, that when we see that more cases and more deaths were coming up, but still there are people who are promoting these methods instead of vaccines and other issues in Turkey as well, and I believe throughout the world. And of course, they are not shown to be very effective like vaccines. And I think that this is a hidden agenda, most of them, to promote themselves and their products.
Yes, ma'am. Like how to people are asking like, how to compromise old people who doesn't accept these scientific things. Not
I, excuse me, there's an echo and I really can't hear you well.
ma'am, how is now? Can you hear me?
Um, is it a way that I can see the questions? No, I think.
Ma'am, the question is like how to like enlighten them, mostly old people who are doesn't believe the scientific things much easily.
People who doesn't believe in scientific change, you mean?
Yes, ma'am. Scientific things, ma'am. Old
Scientific,
people.
old people.
Yes, ma'am.
Old people. Yeah. In fact, I don't like to discriminate people like young and old, but when you look at the aging issue, they have different experiences about, and they have a very solid political vision, and they have very solid cultural vision. So they are not, some of them are not so much investigative. They just accept what they are recommended. But the others, yes, they really have difficulty in understanding the new evidence. And since they have their own background, post-truth is very big, and they will have difficulty in accepting. But this is not because of the, yeah, this is not solely related to the age. The young people also has problems with understanding the information and accepting the vaccines that they are recommended. Have experience and challenging work in your career? Could you please share us on that?
Ma'am, the next question is, have you experienced any challenging work in your career? And could you please share us how you dealt with them?
I think the experience challenging work, you mean the people who is hesitant and do I have to work with them? Is that the question?
Ma'am, any experience which you
Like
would have?
like their intention is related to vaccine acceptance and hesitancy only. Because our current topic is that's only right.
Hesitancy, you
Yeah.
mean?
Yes, ma'am. Same.
Of course, there are challenging individuals, and just what I do is, personally, what I do is, first I start with the word, I understand that you have questions in your mind and you have concerns about the vaccines that I'm proposing. And when you start with this, I understand that you are wanting the good of your child. When I start with that, now they start to listen to you. And then the next is, what is your concern? Can we talk about that? And usually they are giving me a reason. And say it is a reason of, I don't know what's inside. Then you may ask, or they may say there are lots of antigens in the vaccine. Then I tell them that when you first feed your baby, it's minimum 50 antigens. And the total of antigens that are given to your child until 3 years of age is only 69. And when your child starts to eat from outside, when you buy a soup and make your drink outside in a restaurant, it's more than 5,000 antigens. When your child has a cough, it's 150 antigens counted. So your baby's immune system is ready for this. So this is just an example, of course. It depends on why they are hesitating. Of course, there is challenging. But sometimes they say that my mentor said, it may be a religious mentor, cultural mentor said, you should not get vaccinated. Sorry, I don't listen to you. Just I say that, just listen to me. I will provide you information. Just think about it. We are here. Our vaccine is here. Just think about it. And then we will be waiting. So just what I'm trying to tell you is, just you have to pull the person in the same ground and just get rid of the feeling that he is on to me and is on top of me and he or she is insisting on what she wants to be. This is not so. Yes, we are the authorities because we are the healthcare professional, but we are not the boss. We're not the boss of those individuals. We have to understand them. And if you understand and still they do not change their mind, still you should say that we are here waiting for you. Just let me tell you what I am telling. If she doesn't listen, okay, don't listen today. I'm here. If you have questions, I will be here. So it depends on why people are hesitant. So of course there are challenging words. And of course, there are different ways to deal with them. How can best organization like
Thank you so much, ma'am, for the insightful answer. And the next question is, how as vast organization like World Health Organization will deal with infodemics?
WHO has set an infodemic management team. And in this team, there are communication experts and IT experts, internet experts, and all those kind of stuff, socialists and sociologists, and psychiatrists, and people who are really good at following the social media experts. These experts are coming together and working on the social listening and how there's a debunking process, which means that you just listen to the rumors and then prepare some answers to them and widespread the answers. And things like that are being carried out. And there is an infodemic management team who are giving infodemic manager trainings. And it has been, as far as I know, repeated twice. And the third one will be coming in the future. And from different backgrounds, not only the healthcare personnel are involved in these manager trainings. And within the ethical limits, they are listening to the world, and they have maps, they have geographical maps, and special maps are used to see how the misinformation is being spread throughout the world, and they are trying to be proactive and prepare some information booklets, information sheets that are flash news that are shared with the ones who are in need of it. And they are trying to make a web within the world and have experts who have really experience on this infodemic management and work within the country level to provide credible information.
Thank you so much, ma'am.
Thank you.
Yes,
Yes,
Zainab.
more questions.
Zainab raised the hand. She want to speak anything?
Yeah. Dear Professor AKSAKAL, first of all, we'd like to thank you for this precious and informative speech. And I want to ask you that as medical students, what should we do to raise an awareness of vaccines in people? Should we do brochures and or guidelines or do workshops? What do you think?
Mm-hmm. Yeah, this is an area that I have been working on more in last few years, and I have prepared some projects on this as well. And I believe that the students and the new generations are our target group. And of course, you believe in vaccines and you learn how vaccines work and how vaccines prevent the vaccine preventable infections. These are all taught you within your faculty years. I believe that in most of countries this is so. But what is lacking is, yes, you also have communication skills in some countries as well. In Turkey, we also have communication skills, practical sessions. But what is lacking is having and merging them. I mean, you have the information, but you don't have the practice to communicate this information, to persuade individuals with vaccine hesitancy and just making behavioral changes. That's why I think as medical students, I think this topic should be the topic of a symposium, for example, or regular courses should be set, can be set, and the peer education may be used for this vaccine communication skills, and this will be very effective, and this will prepare you for facing the individuals who are vaccine hesitant in the future.
Thank
And
you.
I think you have to know your force first, your strength.
Thank you so much.
Okay.
Tarun, do we have more questions?
I think that's it.
Ma'am, I think we'll wait for a minute. Tarun, are you there? I think he's on
Yeah,
mute.
sorry, I'm in mute. So yeah, we can wait for 1 minute because there is a slight delay in YouTube and Zoom. If you get any questions, we can ask. So my dear delegates,
Sure.
if you have any questions, please feel free to drop in the chat box. We will ask madam.
I think you have a reward or a book.
Yes, ma'am. I think we have no more questions. I think we cannot get any in YouTube. So please proceed for vote of thanks, ma'am.
Sure. On behalf of Squad Medicine and Research and the entire committee of MedInvade 2021, I would like to express my heartfelt gratitude towards our honorable speaker, Dr. Noor ma'am, for taking out her valuable time and enlightening our delegates with her knowledge. I would now request all the delegates to fill the post-event form which is there in the YouTube live chat. Thank you for your cooperation and support.
Ma'am, please wait for a few more minutes.